Welcome to Daybreak Safe Transfer. We are going to be practicing safe transfer from the bed to the wheelchair, from the wheelchair to the chair. We are also going to include the gate bell. Good morning, Miss Jewel. How are you?
Just fine. How are you today?
It's so good to see you. You're so colorful and awake this morning.
Well, thank you.
We're going to go ahead and get started and getting you up. I'm going to get you in the wheelchair today. Is that okay?
That sounds great.
Okay, let's get started. You always want to make sure that you have your gate belt. This gate belt was designed to do exactly what it says. Everybody knows in the healthcare field that gait means your ability to stand and walk. Ambulatory means you are walking, okay? This is a powerful piece of equipment. Doesn't look worth nothing, but it does the job for you, okay? I always roll my gate belt up with the buckle on the outside. And the reason why, it's easier for me to wrap it around my client when it's time to get them up and put the belt on, okay? Usually I'll have it on the nightstand next to them. Some people keep it on the back of the chair. Whatever works better for you when you're operating your equipment and when you're getting the client ready, okay? So Miss Jewel, I'm going to go ahead and I'm going to go and let the bed roll down. I know this is going to be a little cold, okay? So I'm going to pull the covers back. You're not really wanting to shock them with the, the cool of the air. So you always let them know, again, here's my pulse check. I'm getting ready to pull the covers back. It may be a little cool, so you're setting the expectation, okay? So here goes my covers. Okay. Next thing I want to do is I want to try to make sure that I get her closer to the side of the bed, okay? So, because we know that she is a little bit ambulatory and she's able to move, could you come on and scoot to this side of the bed for me, please? And then you can assist them as well, if you want to, by placing your hand underneath the neck and placing your hand on the knee, okay? Come on towards me, and then we're going to sit her up. I'm going to sit you up, okay? And then I'm going to take my hand, and I'm coming straight this way. We're going to turn. Okay? Everybody got that? Mm-hmm. Most important thing, once she is there, are you okay?
Yeah.
Because she's coming to a sitting position from laying down. What happens with the blood pressure? Exactly. So I'm not going to just have her sit here and immediately get her into the chair. No. Because anything could happen. That's why you always do that pulse check and ask, are you okay? Okay? The other thing is, I want to make sure, now that I've got her sitting up and she's told me she's okay, I'm going to bring my chair in a little closer to her. I'm coming in at an angle. And the reason why I come in at an angle is because once I position the gate belt onto the client, I'm able to start my technique, okay? She's in the perfect position. She's told me she's okay. I always put my bed tray on the right-hand side or whatever the side that it's infected, because that's the fastest way for you to keep moving. And it's all a flow. I'm going to go ahead now and I'm going to put the belt on you, okay, so we can get you ready to stand up. With your gate belt, if you put your buckle on the outside, do you see that I'm just going to roll it around? I don't have to do anything. Could you lift your arms up for me, Miss Jewel? That's it, okay? I don't have to worry about where the buckle's at. I don't have to second guess myself. Everybody pick the teeth, grip into the belt, okay? And I don't like to put it on really tight, but I don't like to put it on really loose either. What I do is I take my forefingers and I put them right here underneath where I can feel a little pull, okay? And you always go underneath the belt. Do not come over. You can do it this way, but you're not going to have the security of the belt working for you. Always take your hand and go under, okay? So I know that that's about right for her, and I'm going to go ahead and lock my belt in. And because Jewel is so small, and she's a lady, I'm just going to do a little fanciness. Y'all know how we used to do these with the belts years ago. Y'all remember that? Mm-hmm. This back in style now, too. So, now, she's securing the gate belt. Okay, so what we're going to do now is I'm going to go ahead. The most important thing of this, you guys, your foot is going to stop her feet from moving. And she's got on socks. Okay? So, you look at this. If I got my foot here, where are her feet going?
Nowhere.
Nowhere. So when I use the gate belt to get her up, what do you think's gonna happen? She's not gonna go anywhere and I'm in control of it, right? Does anybody see me touching her yet? I'm not touching her. Do we need to touch her? Not when you're lifting with the gate belt. Now that I've got my feet secure, I'm gonna let her know. I'm gonna bring my chair back in. I'm always at an angle with my chair. Okay, Miss Jewel, on the count of 3, we're gonna get you up and we're gonna get you in the chair. So we're going 1, 2, 3. There you go. And she's in the chair. Are you okay?
I'm not.
Okay, let me go ahead and put your feet up here. SafeTransfer. Most important things is making sure that your belt is on right, using the correct technique of coming underneath the belt to grip, and making sure that your foot is always in front of the client's feet so that they cannot slip or slide. You do not need to bend, you do not need to grab. All you need to do is let the equipment, which is what it's designed for, it works for you. It's called a gate belt for a reason. It's also called a wheelchair. And your legs and backs need to be saved, but use the legs first. You should never have to use your back. Okay?